Assalamualaikum. Assalamualaikum students. So today we will discuss the MCQs regarding the female reproductive system for BS nursing. So which of the following structures is not considered as part of vulva? So the vulva consists of clitoris, the urethral orifice, the vestibule, the labia majora, the labia minora. So vagina is not the part of the vulva. Vagina is the internal genital organ. Now, labia majora are best described as these are the folds of skin with fat and sweat glands forming the boundary of the vulva. Hair growth during puberty is observed in which part of the external genitalia? So, labia minora only, no clitoris, no mons pubis, and lateral surface of the labia majora is the correct answer. There are no hair on vestibule, there are no hair on posterior. Vestibule is located in between the labia majora, posterior to the clitoris and anterior to the anus, between the labia minora, where urethra and vaginal opening orifices open. So vestibule is located between the labia minora, where the urethral and vaginal orifices open. The greater vestibular gland opens into vestibule. Clitoris is homologous to which male structure? Penis. Which of the following best describes the function of the clitoris? It contains erectile tissue and sensory nerve endings. Vestibular glands are located. So again, the same question. It opens into the vestibule and on each side of the vaginal opening. The secretion from the Bartholin glands primarily function to it has the function to moisten the vulva. Now, which of the following is true regarding the vestibular glands? They correspond to the prostate glands in male. They are like prostate glands in the male vestibular glands. The main arterial supply to the vulva comes from the branches of internopudendal and externopudendal arteries. Internopudendal artery is the branch of internal iliac artery, while externopudendal arteries are branches of femoral arteries. Internal pudendal arteries are branches of which major artery? So it is the internal iliac artery. Venous drainage of the external genitalia eventually flows into the internal iliac veins. Lymph from the external genitalia primarily drains to the superficial inguinal lymph nodes. Which nerve provides the main sensory and motor innervation to the external genitalia? It is the pudendal nerve. Perineum is best described as an area extending between the base of the labia minora to the anal canal. Which of the following is not a part of female internal genitalia? So, labia minora is not the part of internal genitalia, while vagina, uterus, ovaries, uterine tubes are parts of female internal genitalia. Which type of epithelium lines the inner surface of the vagina? So, it is stratified squamous epithelium. And in anatomical position, vagina is directed obliquely upward and backward at about 45 degrees. Difference in length between anterior posterior vaginal wall is due to angled insertion of cervix through the anterior wall. Proximal end of the vagina is connected to the uterine cervix. Hymen is best described as a thin mucous membrane partially covering the vaginal opening. So the hymen is typically incomplete to allow the passage of menstrual flow. Which of the following is not a layer of vaginal wall, inner ciliated columnar epithelium? Which structure is responsible for moistening the vaginal surface? So vagina has got no glands, and the secretions that moisten the vagina comes from cervix of the uterus. So cervical secretions are responsible for moistening the vaginal surfaces. What maintains the acidic pH of the vagina in reproductive age females? Lactobacillus acidophilus producing lactic acid. What is the main arterial supply of the vagina? Vaginal and uterine arteries from internal iliac arteries. Which lymph nodes primarily drain the vagina? Deep and superficial inguinal lymph nodes. Which of the following is not a function of vagina? Site of implantation of the embryo. Which of the following statements about the position of uterus is in most women is correct? It is anteverted and anteflexed. The vesicouterine pouch is located between the bladder and the uterus. The rectouterine pouch, that is the pouch of Douglas. This is important. The pouch of Douglas is located between the uterus and the rectum, while the vesicouterine pouch is located between the bladder and the uterus. Which part of the uterus protrudes into the vagina? Cervix. The thickest layer of the uterine wall is the myometrium. Which uterine layer is shed during menstruation? So it is the functional layer of the endometrium. Endometrial blood supply is derived primarily from spiral arteries from the uterine artery. Stratified squamous, which uterine structure is continuous with lining of the vagina, is the stratified squamous epithelium of lower cervix. Main arterial supply of uterus is via the uterine arteries from the internal iliac arteries. Uterine arteries reach the uterus by passing between the two layers of the broad ligament. Lymph from the uterus and uterine tubes drain into the aortic and iliac lymph nodes. The nerve supply of the uterus includes parasympathetic from sacral outflow and sympathetic from lumbar outflow. Which of the following ligaments contain the uterine tubes and supports the uterus? Broad ligament. Which ligament extends from the uterus through the inguinal canal to the labia minora? Round ligament. Uterosacral ligament provides posterior support by extending from posterior cervix to sacrum. Transverse cervical ligaments support the uterus by connecting the sides of the cervix and vagina to the pelvic walls. Which of the following is a function of uterus? Nourishing and protecting the fertilized ovum and fetus. Which hormone prevents the uterine contraction during pregnancy? This is the progesterone. Which hormone becomes predominant at term to stimulate uterine contractility? This is estrogen. And then we have the oxytocin stimulates uterine contraction during labor. Its release is controlled by positive feedback mechanism. Fertilization of the ovum usually takes place in the uterine tube. So implantation usually occurs in the uterus and fertilization takes place in the uterine tube. Fimbria of the uterine tube project from the lateral end of the uterine tube, catch the ovum. The ovarian arteries supplying the ovaries arise from abdominal aorta below renal arteries. Ovary is attached to the uterus by which ligament? Ovarian ligament. Which structure in the ovary forms after ovulation and secretes hormones? This is the corpus luteum. Primordial follicle, Graafian follicle, these are the different stages of development of the follicles which are present in the ovary. And corpus albicans is the remnant of the corpus luteum. And while medulla is the part of the ovary, inner part of the ovary. So ovary has got two parts, outer cortex and inner medulla. Which ovarian structure remains as a scar after regression of corpus luteum? This is the corpus albicans. Lymph from the ovaries drains into the para-aortic and lateral aortic lymph nodes. Breasts are considered as secondary sexual characteristics. Each breast contains approximately how many lobes? 20 lobes. The functional unit of the breast where milk is produced is the lobule. The lactiferous ducts drain milk from the lobules to the nipple. What structures in the areola help lubricate the nipple during lactation? Sebaceous glands or Montgomery tubercles? The main arterial supply to the breast comes from all except the thoracic aorta directly. The main lymphatic drainage of the breast is to axillary lymph nodes. While stimulation of the nipple during breastfeeding activates prolactin release from the pituitary, posterior pituitary. Milk production is stimulated by which hormone? Prolactin. Which nerve roots supply sensory innervation to the breast? T4 to T6. So I hope this is helpful for you. in understanding the anatomy of the female reproductive system. Thank you.